I would like to talk to you today about Tay Sachs disease. Tay Sachs disease is a recessive genetic disorder. It was first discovered in the 1800s by a British ophthalmologist named Tay Warren. Warren first discovered the cherry red spot on the back of the retina. Later, Bernard Sachs, a British neurologist, discovered the correlation between the Jewish population and the disease. He also noted the degeneration of the neurological functions. The disease is caused from a missing vital enzyme called Hex-A. Hex-A breaks down a lipid called GM2, and without this vital enzyme, there becomes a buildup of GM2. And with this buildup, we have a progressive loss of neurological function. This means that when the child is born with the disease, he or she will begin to develop normally until around 3 to 6 months of age. Then the child will start to lose their motor skills. They'll lose the ability to see, to hear, to swallow. They will also lose muscle tone. And as most children, as they become older, they become more independent. With these children become more dependent. Usually by age 3, these children start to have debilitating seizures. They will become unresponsive to their environment. Some even have to have feeding tubes or may even need to be placed on a ventilator. Usually the child will die around age 5, usually from aspiration pneumonia or malnutrition. The disease mostly affects the Ashkenazi Jewish population. This is the Jewish population from Central and Eastern Europe. Roughly about 1 in 27 Jewish people are affected by the disease. This means that they are carriers of the disease. And I mentioned earlier that the disease is only recessive, which means that both parents must be carriers of the disease for the child to have the disease. There's a 25% chance that the child will not be a carrier or will not have the disease. There's also a 25% chance that the child will have the disease, but there's a greater chance, a 50% chance, that the child will just be a carrier of the disease and not have the disease. Testing for the disease is fairly simple. After the infant is born, and if the child develops symptoms that the physician believes are Tay Sachs disease, the child will be tested for Hex-A levels in the blood. They will also look for the cherry red spot on the back of the retina. There's also prenatal testing that can be done for women who are in a high-risk group, such as both of the parents are carriers of the disease, or even if one parent is a carrier of the disease. The prenatal testing that can be done is chorionic villus sampling, which is a sample of the placenta taken for testing. They can also have amniocentesis done, which is an ultrasound-guided procedure where a needle is inserted into the abdomen and a small sample of fluid from around the baby is taken to be tested. And both of these can be done during early pregnancy. And to date, there is no treatment for Tay Sachs disease. The only care that can be offered to the children who suffer from this very rare disease is palliative care. And what palliative care is that means that the symptoms will be treated and just make the child as comfortable as they possibly can. There are support groups for families and loved ones that are going through this disease or that have someone that has this disease and they really just don't know what to do. There's many support groups for this. And there's ongoing research in ERT. ERT is enzyme replacement therapy. There has been some early positive effects shown from ERT, but nothing long-lasting. There's also ongoing research with stem cell transplants. But again, none have been shown effective for the treatment. And in conclusion, prenatal testing is very important for those high-risk groups, for either the mother or the father or both parents that could be carriers of the disease. It's very important to know what you're up against when you have a child born with this rare disease. And having lots of family support and a good support system is very important to the family and to the baby. And the most important thing to help these families and these children with this disease is finding a cure for the disease. Thank you.